Welcome everyone. Today we're going to be discussing nicotine and tobacco. My name is Nicole Gastala. I'm family medicine and addiction medicine, and I do my clinical care at the University of Illinois Chicago at Miles Square Health Center System. Today we're going to be discussing the epidemiology of nicotine use disorders, the neurobiology of nicotine and addiction, as well as psychosocial and pharmacologic treatments for smoking cessation. Epidemiology of nicotine use disorders. So you have a 17-year-old patient who comes to your practice saying that it's no big deal because everyone is doing it. To provide him or her with accurate information, what is the prevalence of use of tobacco products in the general population of the United States? Is it 10%, 15%, 19%, 23%, or 30%? It's actually 23%. And although use of tobacco products have decreased over the past decade, according to the National Survey on Drug Use and Health, from 30.4% to 23.5%, electronic cigarette use is becoming more and more common among U.S. youth than traditional cigarette use. So really important to discuss this with our patients. Cigarette smoking is one of the leading causes of preventable death in the U.S., about 0.5 million, and in the worldwide about 5 million every year. Nicotine is the psychoactive component of tobacco that causes arousal during fatigue and relaxation during anxiety. In terms of the percentage of smokers in different groups, according to the whole U.S. population, it's about 15%. Of those who use daily, about 11%. About 30% of those are individuals who see a physician, and those who see a mental health professional between 40 and 50%. And then those who have specifically ADHD, schizophrenia, and bipolar disorder, the percentage of smokers in those groups is between 60 and 85%, so really high, very important to address. And only about 15% of smokers report being offered treatment by physicians, which is why it's so important to screen as well as offer treatment. Nicotine is a naturally occurring alkaloid. It's a powerful neurotoxic if you're naive to it. And the benefits of smoking cessation include an all-cause mortality return to a non-smoker after about 10 to 15 years of abstinence. And so this can be a really good positive reinforcement for patients when you're talking to them about smoking cessation. So we're going to describe a little bit more about the neurobiology of nicotine, and this is important for the exam. So nicotine is a tertiary amine that consists of pyridine and pyrrolidine rings. There are two stereoisomers of nicotine. The S-nicotine, which is the active isomer that binds directly to the nicotinic cholinergic receptor, and particularly within the ventral tegmental area. There are two major subtypes of nicotinic receptors in the brain. You have the alpha-4 beta-2 subtype as well as the alpha-7 subtype. Nicotine directly causes dopamine release in the nucleus accumbens by binding to the alpha-4 beta-2 nicotinic postsynaptic receptors on dopamine neurons in the VTA. This may seem sort of like a minor sort of pathway understanding, but is actually pretty common on your upcoming exam. So important to sort of recognize as to what receptor nicotine binds to and where in particular the dopamine is released. Nicotine also binds to the alpha-7 nicotinic presynaptic receptors on the glutamate neurons in the VTA, which then in turn releases dopamine in the nucleus accumbens. Nicotine also desensitizes the alpha-4 beta-2 postsynaptic receptors on the GABA interneuron in the VTA. And here's an example of what that would look like and how it binds, and then the sodium-potassium channel and the energy potential.